So what do you do with Shiloh in his snotty nose? Well, you can try moistening the nose. That makes good sense. I tried encouraging, and I still do encourage, but now I make it easier for him. I give him some. But for 20 years I used saline because it made sense. But it doesn't help resolve ear infections. And maybe it cut my incidence of sinus infections by half. Maybe. Probably less than that. But it still makes sense. And irrigation may be more effective, but despite Dr. Oz, irrigation washes the mucus out. And the mucus is a defense. That's what holds on to the garbage. So you want to just stimulate this a little bit. You want to help it a little bit. You don't want to overwhelm it. If you're talking about irrigation, you know, how long since we as physicians have encouraged women to douche? We don't do that anymore. Because the vaginal biofilm, and it is a biofilm, Lactobacillus vaginalis is the primary bacteria living in the vagina, and it's protective. So biofilm is not all bad in the body. It sometimes is good because it protects us. When Jerry and I a few years ago were scuba diving on the Great Barrier Reef, we were cautioned, don't touch anything, because these marine organisms are protected by a biofilm, and even touching it can be disruptive and open these organisms to infection. So there's both sides of that. If you put a nasal osmotic agent in the nose, like xylitol, like mannitol, like any of the alls, it will pull fluid into this area, which is helpful. The first study that was done was at, that I know about anyway, was done at Johns Hopkins by this group in 1988. They used mannitol. They found out that when they put mannitol in somebody's nose and then measured it 30 seconds later, that there was more volume in what came back out, and there was more histamine in what came back out. Now, back in 1988, histamine was a bad guy, so they stopped that in that line of research. But histamine, again, is the trigger for the washing, and it makes sense to have more histamine in after you stimulate that a little bit. But if you put an osmotic agent in the nose, especially one that is hyperosmotic, and I even noticed with your studies that you use 5% of xylitol. 5% xylitol is isoosmolar. It doesn't act osmotically. That's the body's normal osmolarity, is 5% xylitol. So you need a little bit more than that if you're going to get any effect in filling up this airway surface fluid. And Xlear has more than twice 5%. It's 11% xylitol. So it's hyperosmotic, and it will pull fluid into this area. Pulling fluid into this area means that the cilia work better, that the mucus is looser, stickier, able to clean out better. It facilitates this process. Now, how often do you use it? This is from the dental studies. Once a day? Nah, forget it. Twice a day, a little better. 5 times a day, 80% reduction in tooth decay. Now, when we started with Xlear, a long time ago, I had 10 kids in my practice with chronic ear infections. And these 10 kids, I counted up the ear infections or the ear problems they had for the 5 months before, cumulative 50 months before, and they had 43 ear infections in that period of time. And I watched them for an average of 11 months each, which was 110 months total. Over that 110 months, they had 7 ear infections. And that's a 92% reduction in what was expected. And it's even better than that because of the 7 ear infections that did occur. 3 of them, 7, happened when the when treatment was interrupted. 4 of them were in one child who I lost track of, unfortunately. I would have loved to have seen what was going on, whether it was treatment, because certainly the way you spray your child's nose can make a difference. What we told parents is to hold the baby up, spray the nose, lay him down, change the diaper so the fluid runs to the back of the nose where it's effective, And if they did that every time they changed baby's diaper, 95% reduction in ear infections. Similar benefits we saw with other nasal problems. Sinus infections are gone, allergies are helped, asthma is often eliminated. The Scheck study from Dr. Callanan, it hasn't been published yet because we can't find Dr. Callanan anymore. But there are 100 children with otitis and are reduced by 57% with 3-time-a-day dosage. So essentially the same kind of reduction as you see with tooth decay using xylitol and gum 3 times a day. People at the University of Iowa took Dr. Uhari's material and ran with it. They looked at safety factors. They found out that xylitol, when you spray it in your nose, is not absorbed. It is just mixed in with the mucus and passed down so you swallow it. When I first was talking to the FDA, they were interested in safety factors, of course. I told them that 10% of the dry weight of a plum is xylitol, and that if you sprayed your nose, both sides, every hour, 24 hours a day, you'd get about half a plum's worth of xylitol. They thought that was pretty safe, and people at Iowa have made it even safer because they have assured us that it's not absorbed through your nose. They found out that it decreases colony counts over 2 days of all bacteria, and even staph was one of the ones that they found it to decrease. The thing that they focused on is the decrease in the saline concentration in the nose, because saline concentration is directly related to hampering your defensins. Those little protein antibiotic substances in your nose don't work as well when there's a high saline concentration. So reducing the saline concentration with an osmotic agent makes sense to them. This is the study that triggered the people at Iowa to do their work. And this is a study done by Matti Uhari and his group in Finland to try and find out why the chewing gum study worked. And this is an in vitro study, laboratory study, looking at the adherence of nasal pathogens in the presence of xylitol. And the first section on the left is no xylitol. What they did is they took cells from the nose and bacteria from the nose, and they divided them up, and they put xylitol with some of each, and then they mixed them and matched them and put them together. So if there was no xylitol in the environment, you have a whole lot of bacteria holding on to these cells. If you put xylitol with the cells and mix them up together, you find a reduction. About the same kind of reduction if you put xylitol with the bacteria. When you put xylitol with both, you got a 68% reduction in strep pneumo, which is the major nasal pathogen, and not significant but still noticeable decreases in H. flu and Moraxella catarrhalis. Again, it decreases the ability of these bacteria to hold on. Now, Mary's talked a lot about xylitol and biofilm. Her partner sent me this, at least in an email, sent me this little bit of information that has a broad spectrum ability to reduce, and Mary talked about that in her presentation. Dental researchers say the same thing. How does it do that? Well, first of all, like we've been talking about, it empowers the defenses that we have. In the case of teeth, it makes our teeth stronger because it carries that calcium into the teeth. In the case of the nose, it increases the fluid for the washing and it increases the defensin activity. It handicaps infecting agents because if they eat it wrong-headedly, they think they can use it for a carbon source to build and grow, but they can't because they don't have the enzyme systems to digest 5-carbon sugars, so they get indigestion. And Tero Kontiokkari has some very nice pictures in one of his articles looking at what happens to strep pneumo when they eat xylitol, and it really disrupts their cellular appearance. Gives them indigestion.